Hi, welcome. How are you? Good. Okay. Have a seat. Get comfortable. Okay. My name is Dr. Elo, and you are here for a wisdom teeth consultation, is that correct? Yes, okay. Alright, so how are you feeling? A little nervous. Okay, well, hopefully, in our appointment session today, we can kind of work through any fears or anxieties you're having and get you feeling really comfortable with the procedure before it happens, okay? Okay, so feel free to ask me any questions that you might have along the way. Yeah, there's no questions that I won't answer. People have asked me pretty much everything, so don't feel shy or like your question's gonna be dumb. I guarantee you I've heard it before. Okay. Alright. Is this your first time having wisdom teeth removed? Yes. Okay. And do you know, have all of them come in? Do you know the status of where they're at? No, that's okay. I'm gonna take a peek in your mouth in a little bit here, and I'll do an assessment myself and tell you what's going on. Okay. All right. Is it okay with you if I just take some notes as we're talking? I'm just gonna be kind of recording the important parts of our conversation so that we both know that we're on the same page. Okay. All right, great. So this is your first time. Have you had any oral surgery before whatsoever? No, okay. Have you been sedated before for any sort of surgery? Just had local anesthetic, okay. Okay. And did someone refer you to come in to get this procedure done, or are you feeling some pain? Okay, so kind of a little bit both there. Alright, so your regular dentist suggested that you come to me because you are having some pain and tenderness. Okay. Do you remember the name of your dentist? Okay, great. She's really nice. Okay. All right. And can you describe to me a little bit how those symptoms are feeling for you? Are you in pain right now? Would you like some Aleve? Okay. Well, if it gets any worse, let me know. We can always send some with you when you leave as well. Okay. Are you nervous about taking medicines generally? Yes, okay. That's alright, I am too. It's very strange to ingest things that we don't quite know what they are, so I'm completely on board with that. But you will, I'll let you know what kind of situation we would have to do for your pain management after the procedure, but you would probably need to take at least some sort of over-the-counter pain relief. Most people really don't need more than that, honestly, depending on the severity, like I said, of their where their teeth are at. So we'll see, and we'll gauge that and kind of walk you through that as well. Okay. So, do you feel a tightness, throbbing? Is it an aching pain? Is it very sharp? Okay. And that's on the upper left. And throbbing on the lower right. Okay. When did you first start noticing those symptoms? Okay. And don't worry, I'm not going to judge you on anything. It is best, though, to give me as accurate of information as you can, just so I can rule out the chances of there being any infection. If your wisdom teeth area or any area in your mouth has an infection ongoing, we will need to treat that infection with a course of antibiotics before we can actually even do the procedure. So it's really just for your safety. Okay, but you're not feeling those kind of intense pains for a long time now. It just kind of comes and goes. Okay, that can be pretty natural, especially if some of your wisdom teeth have or are trying to break through the gum line. It's kind of like when a baby is teething, you know, and it just gets really sore and tender there. Yeah, that's pretty normal. Okay, is there anything else you wanted me to know? No? Okay. Alright, well, if it's okay with you, I'm going to grab my tools, pop on a face mask, and I'm going to come really close and just have a look around in your mouth now and see what we're working with, okay? Alright. This part might take me a little while. I like to be very thorough. I'm also going to look around at the rest of your teeth at the same time, just to see, like I said, if there's any signs of infection or anything else that we need to worry about, okay? I want to make sure that we're as safe as possible. Okay. I can just have you lay back a little bit in your chair. I'm not going to tilt you to the moon, don't worry. And I've just got a mirror and a little pick here. I'm not going to poke your gums whatsoever. I'm just going to tap a little bit on your teeth. You tell me if you feel any pain, okay? Okay. Can you feel that? Okay. Can I get you to say ah, please? Good, you can relax. Can you bear your bottom lip down at me there so I can... Yep, I'm just going to use the mirror to pull your lip away here. Good. Okay, I'm working around to the right side now, and then I'll let you close your mouth for a minute. Your mouth looks a little dry. Is that typical for you? Yeah. Okay. Well, if you do need some water, this little faucet here, you can just use the spray gun. Yeah, it's filtered water, so. Okay. Alright, you can go ahead and close your mouth for a moment. Okay. So on the bottom, what I'm seeing is that your back left is almost fully through, actually, which is great. The back right, where you were feeling that kind of throbbing, it looks like it's coming kind of close to erupting, which is the technical term for just it breaking through the gum line. So that's getting pretty close, which is probably why you're feeling that kind of on and off throbbing pain. Yeah. But the good thing about both of those being the way that they are is that it'll be a lot easier to remove them. So we'll hope for similar outlooks on the roof of your mouth as well. Yeah. Okay. Okay, you ready? Alright, if you can just open up for me again, tilt your head back. And it was in this upper left that you were feeling most of that sharp pain, right? Remind me, how persistent is that? Okay. Can you just say ah for me again one more time? Sorry. Ah, good. Okay. Alright. Gonna work around your teeth again here. Coming around to the front. And pull back your top lip best as you can, kind of in a grin. Good. Okay. Okay. And I'm just going to use my finger really quick to feel in the top right back, okay? Okay. Okay, so what it looks like to me is that your upper left, the one that's been giving you that pain, that one is hurting because whereas if you're lucky, your wisdom teeth will come up straight next to your other teeth and not create any issues. That one's kind of on an angle, okay, which can cause trouble with bacteria and food debris getting stuck kind of in the crevices, which is why even though that one is kind of almost all the way erupted, it's still really good to get rid of those ones, especially because they can lead to further troubles with your oral health in the future, even if they stop hurting. Oftentimes people will report no pain in those kind of teeth, and then later on down the road they end up with terrible cavities or other bad bacteria issues in those teeth because of the angular way that they kind of came in. So I do think that it's a good idea for you to go ahead and get these 3 wisdom teeth removed, and all at the same time if you can. I don't actually see one on your upper right, and I don't feel any sign of one coming in. Did you take x-rays, do you know? You did. Okay, those should be in the file here then. Let me try to pull those up. Give me just one moment. You can relax. Look at that. You actually don't have, you only have 3, which isn't, I mean, I think a lot of people either get none or all 4, so it always interests me when I see like a combination, but that's good. So then you'll have at least one area where you don't have to worry. Okay. Alright, so that looks good, and I can see here in the x-ray kind of, it looks like it was in an earlier stage than it is now when you got this picture taken, but I can see where that angled tooth, it did come in at a pretty severe angle, which definitely caused all that sharp pain you felt. Okay, well, I'm going to look again in your mouth if that's okay, now that we have kind of a rough idea. Do you have any questions at this point? Yeah, I do think, I mean, not everyone opts to get all of them removed at the same time. I myself only got one side done at first because I'm a scaredy cat, and I just wasn't sure how the process was going to go. I tend to be a more sensitive person, so I wanted to kind of try it on for size before I took all 4 of mine out, and I certainly wish I had gotten them all done at once because it's really not that bad. The odds of anything going wrong, having any sort of complication, they're very low in this kind of procedure. Wisdom tooth extraction is incredibly common, and it's such an easy science at this point that it's like a walk in the park for people to do it often, which I do many wisdom teeth removals a week. So I wouldn't have any hesitation to advise you to get all 3 taken out at the same time. I think that they're going to be fairly easy based on their positioning and location to extract. Yeah, good question though. You certainly can still choose to do them separately, but I think economically and in terms of only having to recover once, that's way more preferable for most people, just getting it over with. Okay, alright, so I'm gonna look again around in your mouth a little bit. I'm gonna use my fingers this time to start off with, just to kind of feel your teeth, the positioning, get myself a little oriented, make sure that there's no loose teeth, no soft spots to concern maybe major cavities, and I might use my flashlight a little bit too, just to poke around, okay? Okay, thank you. I know it's not comfortable all the time. Alright. If I can just have you open here. Good. I'm just gonna feel towards the front here. And I'm not gonna apply a lot of pressure, but enough to where you're not gonna feel tickled or anything. Okay, bottom. Good. Work around to your right side now on the top. Okay. And please let me know if anything feels funny. Okay, and on the bottom now. Good. Nothing feels loose or soft at this point, which is good. And we're gonna do your top left here. Okay. Try not to touch that tooth, it's a bit tender there. I'm just gonna kind of pull your gum aside or your cheek aside a little bit to look at your gum, okay? Okay. It's a little inflamed, a little red, maybe more so than the rest, but I'm not surprised to see that, so I'm not worried. I'm gonna come around to your bottom now. Your mouth looks fairly healthy, which is good. And definitely good that I don't see any signs of infection. Grab my little flashlight here now. Okay. Open for me. Look up. Now just tilt your head back a little bit. Thanks. Okay. Okay. Did you have braces or any sort of dental appliances? Oh, okay. I see. Okay. do see a little bit of a scar on the inside of one of your cheeks there. Do you suffer from canker sores, or do you bite your cheeks often? Okay. I think everybody at least once in their life gets really one bad bite. From what I've seen, you know, certain people are almost more prone to biting their cheeks and tongue than others. I think it has something to do with the sort of shape of the mouth and the oral cavity, but I'm not positive. I do feel fortunate it doesn't happen to me too often. But when it does, yowza, I'm not a fan. Okay, I'm just gonna pull your gum away here. Okay, come around the front. Okay. Do you brush pretty regularly? What kind of toothbrush do you use? Is it manual or... Okay. Nothing wrong with that. Just gonna pull your lip up here a little bit. Check out your gums. Do you ever floss? Okay. Most people don't, or they do only when they have food stuck in their teeth, which, you know, I can't really get too preachy about, even though I know how important it is for oral care. I also know how busy life gets and how it's easy to push something like that aside. I think few people fear teeth as being their downfall in life. I don't think many people think they're gonna die because of their oral health, so it doesn't seem very, you know, dramatic to need to floss, but it is really helpful and can sincerely help prevent a lot of gum disease and things that could ultimately affect your health, if not cause you a lot of pain and discomfort. So of course I have to preach a little and say, you know, flossing is important, brushing is important, but your teeth actually, like I was saying, look in pretty good shape. There's a little bit of sort of plaque buildup along the bottom, which is pretty typical. Some people get a more permanent sort of stain if they've had braces or retainers or mouth guards that they've worn for a long time and weren't able to clean properly or kind of get around. And pretty much no one flosses when they have braces, so that's very, very common. But I feel like what I can see on you is sort of typical buildup that will come away when you just get your teeth cleaned. Okay. So I'm gonna just note down that you don't have any signs of infection. I'm not concerned that we need to run you on any antibiotics, which is good because we can just get this procedure over with faster, yeah? And there was some mild plaque buildup. Mainly, so one trick that I like to tell people is if you're right-handed, you're most likely to miss the kind of left the right frontmost quadrant of your mouth, because you see you're brushing like this usually. So not a lot of people will turn this back around or make the effort to get this kind of area. So you'll kind of notice, if you want to be a little sleuth Sherlock Holmes, you can usually tell if someone's left or right-handed by looking at which side of their mouth has a bit more yellow on the teeth, discoloration on the teeth in that area of their incisors. So right-handed people will often miss their right side, and same for lefties, they'll often miss the left side. So that kind of area is one to look out for no matter which hand you brush with. And then just along the bottom and the front is the other area that I saw a little bit of buildup. Okay, it's a hard area to get. Okay. Now I'm going to take this little tool that I had earlier, and it looks quite sharp, but it's not actually painful because I'm just going to press it into the sort of very middle of each of your larger molar teeth and make sure that I don't feel any softness that would indicate any sort of cavity. Okay? Because we definitely want to make sure that you're not going to have excessive problems when you do get these teeth removed. And, you know, God forbid we take out these teeth and then you start having a different pain and you get worried because you think that it's because of the wisdom teeth when really you just have a cavity or something. I didn't really see anything major on your x-ray in terms of cavities, but since that was a little while ago, it looked like, based on the position, I don't know exactly when you got those. Okay, yeah, so even just your one tooth has come in more since that photo, so you know things can change pretty rapidly in the mouth if you have a deteriorating condition. So I'm just gonna poke all of your molars right in the center, and you might feel a little kind of stick, like a Jolly Rancher kind of. Yeah. Okay. Ready? All right, open wide. I'm gonna start on the bottom. Good. I'm just gonna tap the front ones just lightly. Okay. To the other side here. Good. Okay. Those are all feeling fine. I'm gonna do the upper part now. If you can have you tilt your head back a little. Great, thank you. Okay. Good. Tap along the front here. So the other side. Good. Okay. None of that hurt, right? Excellent. Okay, so now I'm just going to feel along your jawline here. And I'm going to put a little bit of pressure, and just let me know if anything feels tender, okay? How's that feel? Okay. I'm going to press on this bottom. Yep. Okay. And around the front here. Can you push your chin down into my hands a bit? No pain? Okay. I'm gonna press along the top. If you can just keep your lips, you can relax them, but keep your mouth closed for me. I'm gonna press kind of along your gum line all the way till I get to the jaw. Okay. Okay. And I'm gonna push. How's that feel? Okay. Right. I'm just gonna roll the jaw joint with my fingers a little bit here. Feels okay on the upper? Okay, and how about the lower? Feels okay? Okay. Good. Good, good. Okay, so at this point, I feel really confident about the state of things in your mouth, essentially. Not really feeling worried about having these teeth taken out. So do you want to shoot some questions at me? Yes. Okay, so anesthesia, you have a few different options. Your first would be to do a local anesthetic like you're familiar with. It would be a little more high powered, I would say, than what you're used to. It's gonna numb all the way to the nerve, essentially, and we'll just extract the tooth, well, the 3 teeth, kind of the same way that you would be if you were having a cavity filling done. Have you had that? Okay, so you're awake and completely conscious, you're breathing on your own, everything is as it is, except you just can't feel the part of your mouth where we're working. So often people who experience a lot of anxiety don't like that option because they don't want to be able to hear the sounds of the work being done. It really doesn't hurt though, and if you were to feel even a teeny bit of pain, you can just raise your hand and we'll stop. We'll apply more anesthetic if necessary, or just kind of evaluate and see what's happening, because it's very rare for that to happen. We do have, I'm a trained professional. My staff that will be with me assisting me are trained professionals in how much anesthetic to use, which is usually, honestly, the most challenging part, I guess, the part that could potentially go wrong. But we have never ever had an issue, and like I was saying, 99.7%, I would say, of cases, which there are a lot, nothing happens in that situation. We always err on the side of caution. We're never going to give too much anesthetic. Do you do any recreational drugs? Because that would be, no matter what kind of anesthetic you get, smoking marijuana, for example, can alter the effects of the anesthesia on you. And patients who do partake in recreational drugs often need more anesthetic because they have a higher tolerance. Okay. That's a really good thing to know, and you can, if you ever are getting anesthesia for anything else, definitely let them know about that if it changes or not. Okay, so the local anesthetic is your first option. Like I said, you won't feel anything, but you'll be completely conscious. It's just like having a numb area of your face. The second option would be to do a more intense sedative, which we could distribute laughing gas, or put you to sleep intravenously, which those options are a little more pricey, but they are good for people who are feeling nervous about the procedure. We can put you into a state where you are breathing on your own, and you're not completely conked, but you're not going to remember anything. You're not going to be mentally present during the operation. It's a fast-acting sedative, anesthesia, so essentially it will take maybe 20 minutes to wear off as you kind of wake up out of the procedure, and you still won't feel anything either way because we will put the local anesthetic no matter what, to kind of help the mouth readjust and give you some time as that wears off to sort of gauge how it feels and whether or not you want to take some over-the-counter pain medication like I was describing. Like the Aleve is usually what I recommend, and I usually have patients take like 3 pills rather than just 2 or 1 for that situation. Okay. Well, you can think about that then, and let me know whatever you think you'd prefer to do. You can talk it over if you want to. You can schedule your appointment if you want before you leave, and just call back to let us know if you want to talk it over with anyone or just sleep on it. Okay. Either way, I would recommend that you have someone to drive you home from the procedure. If you do the local anesthetic, you can be on your way and do it yourself, but it's always nice to have someone to kind of be around for the first, ideally 24 hours, or at least 12 maybe, to make sure you're okay. But there's not much risk, like I said, associated with this kind of procedure. So if you do the local anesthetic, you can drive yourself home and chill by yourself if you want to. Okay. If you do the other anesthetic, though, you will need a driver. We don't want you operating any sort of heavy machinery or making any big decisions within 24 hours, even though it wears off. Yeah. Okay. What other questions do you have for me? Yeah, so as I was saying, based on the look of your teeth, here, let me see. Yeah, so like I said, you have one that's fully erupted, one that's darn near there, and then your other one, the painful one on the top left there that's coming through, is almost all the way out. It's just hurting because it's at that angle. So based on the fact that 2 are upright and your angled one is almost completely erupted, it shouldn't be a very complex procedure at all. It looks really standard. It looks like something I've done a million times, so in this case, that's a good thing. And I don't expect it to be complicated at all. How long? It should be, from the time you get here to the time you leave, would probably be 2 hours or less. The actual procedure itself might take an hour and some odd minutes, depending just on how difficult it is to get out that angled tooth, because whereas these 2 can just come straight out, the angled one, we want to make sure that we're not doing any damage to the tooth that we're leaving in place. So I may need to take a little more time in extracting that one. I'm not going to get into the details because it freaks some people out, but I have ways. Okay. So oops. There we go. No, I'll go in and look again here. Sorry to make you keep opening and closing your mouth, but let me go in and look again. But I don't see any damage to the tooth currently. I don't feel like it's caused a problem on its way in. Okay. Okay, I'll make sure that I'm very gentle. Okay, so I'm just gonna have you open. Okay. Yeah, I mean, it hasn't cracked the tooth in front of it or anything. There's no signs of any permanent sort of damage. I think it could cause some trouble if we don't do this relatively soon. If you let it sit, for a number of months, I think that there would be some trouble with that tooth in front of it, especially because the way that it's kind of wedged, you're bound to get food stuck in that kind of triangular crease that's being made between the teeth. Yes. Right. But at the moment I don't see any damage. In terms of dental treatments in the future, like I said, I don't really see any cavities or anything that we need to worry about at the moment, so this is the only thing that's on my radar right now for you that I would recommend. Yeah, of course. So after the surgery is over, you are going to have they call them sockets, but it's essentially the area that the tooth was. It takes time for that skin to grow back and form a hardened surface, and we want, in that period of time while it is healing, for nothing to get lodged into that area. So as with any wound, the area will form a clot to stop it from bleeding, which we assist with gauze and these tiny little packets that have clove in them that will stop up kind of the area and help promote healing and stave off any bacteria. So the area will be effectively covered by a clot that your body makes, plus a little clove packet that we provide and will kind of lodge in there when you still have the numbing in, so you won't feel it. And then on top of that, we'll have you bite down a little bit gently on some gauze that will stop everything up. So every once in a while you'll have to change your gauze because there is some residual kind of bleeding, but it's not really as bad as it looks. It's just because you've got so much saliva in your mouth, and so a little stain of red ends up looking like a lot when it mixes with the natural just sort of spit in your mouth. I know it's kind of gross, but it is what it is. And at that point, you'll change out your gauze every maybe couple hours. You will need to eat a soft foods and liquid diet for at least 24 hours, maybe 24 hours, which I know to some people sounds like torture, but it's really not that bad. You can have mac and cheese that's soft, no breading or crispy crust on it. You can have mashed potatoes, ice cream, sherbet, yogurt. They have great dairy-free yogurts now if you're lactose intolerant. There's all kinds of foods you can have. If you do opt to have any sort of slushies or smoothies, that's what I'm looking for, any beverages whatsoever, you cannot use a straw because those clots that your body forms are somewhat gentle. think about when you have a wound on your arm, you know, and when it's still fresh, you can kind of remove that scabbing before it's even hardened. And then once it's hardened, it can be removed too. Our goal and the most important part of your post-operation recovery is to allow those clots to stay in place as your body's healing. Luckily, the mouth is one of the most fast healing areas of the body, so it really only takes a few days, 3 to 5 days maybe, until you're pretty in the clear in terms of those clots. You can increase your hard food consumption, like I said, after about 24 hours, but just kind of be gentle and try not to chew the food in the back on the clots, because there's no easy way to put this. If one of those clots come loose, that is very painful and difficult for your body to kind of regenerate. So as long as you follow the instructions that I'm telling you, which we'll also print off and give to you and or any caretaker you might have through the process, you're going to be totally fine. People who get, they're called dry sockets when you lose that clot, and it is very painful. So I know there's a lot of talk out there about how bad it can be to have your wisdom teeth removed, but those people generally didn't follow instructions that were given to them. They might have smoked or used a straw or ate something hard before they were supposed to. And as long as you, like I said, just adhere to the instructions, that's not going to happen to you. It is rare. It's nearly non-existent in people who actually just follow the instructions. Yeah. So unfortunately, people are just not always looking out for themselves in that regard. So it kind of gives a bad reputation, but you'll be fine, I promise. Especially because you are worried about that. Right. Just kind of baby it and you'll be 100% in the clear. Okay. So yeah, you can have some Aleve, soft foods. Then we would see you after the procedure in like a week or a week and a half, and we'll take out those little clove bits and put in fresh ones as you are healing, which that can be a little bit painful. So I do recommend taking some Aleve before you come to that appointment, maybe like 30 minutes before, but I'll remind you of all of that after this, and whenever the nurse calls you to let you know or remind you about your follow-up appointment, they'll reiterate that with you as well. Okay. And in terms of activity, I don't know if you exercise or run, anything like that, but I do recommend that you keep off of strenuous activity for about a week. Anything that might make you clench or exert yourself, breathe heavily even, like, you know, really intense kind of breathing when you're sucking wind and struggling. We're going to say stay away from that stuff for about a week. And that's, again, because of the dry socket situation. Unfortunately, rigorous activity in a physical nature can jostle those clots. You could accidentally disrupt one. So in order to prevent that from happening, just stick to more basic things: easy swimming, light yoga, walking, maybe bike riding if you have something that's kind of a smooth path that's easy going. But if you're going to be tempted to really, you know, push yourself, if you're just one of those people, then stay off of that as well. Only kind of light, easy stuff. So think of it as a little mini vacation. Yeah. Okay. Alright, so on my end, I think we've pretty much talked about everything that we need to. Did you have any more questions? Okay. Well, if you do think of anything, don't feel afraid to just call and ask. Okay. Alright. Great. Well, if you want to, you can schedule your appointment to have this done on your way out. Don't be nervous or shy. If you don't feel like doing that, you can just call back. And as you know, here at Quake, you're allowed to stay and rest for as long as you'd like until you're ready to head back out into the real world. So feel free to kick back, get comfortable. You can have a drink or a snack if you'd like in the room here. And whenever you're ready, you can head out to reception. Or if you're going to call back, you can exit. And we'll just wait to hear from you. Okay. Alright, great. Well, it was really good to see you. Thank you so much for all your patience. Okay. Bye.